Hey guys, it's Biz from Hospital Business, and today we're going to talk about what is a hospitalist. A hospitalist is a provider who specializes in the treatment of general medical conditions of hospitalized patients. And when I say the word provider, that can mean several different types of providers. It can be a medical doctor who goes to medical school, or it can be a mid-level. A mid-level may be a physician assistant, they now go by physician associate, or a nurse practitioner. And both mid-levels either have a master's or a doctorate or PhD level of education. A hospital's sole professional focus is that of hospitalized patients, and they do that through assessing you through your medical history and by physical assessment. In addition, they plan a treatment plan for you to determine how you're going to get better, and they do that in coordinating care with other health professionals. So, why am I being cared for by a hospitalist? Well, it's simple. Some patients do not have a physician in the area or have a physician that has privileges to practice at the hospital. Back in the day, you would be admitted to the hospital by your primary care physician. So what happened to the good old days? Well, it's simple. When you were being taken care of by your primary care physician, there was often a delay in your care because these providers were taking care of patients in their office and then traveling into the hospital, so you often would not be seen later in the day, and then often it would be hard for the nurses to reach out to your doctor because they were seeing other patients throughout the day. So who is part of the hospitalist team? It's simple. It's everyone. So nurses, your specialty providers, and these are doctors that specialize in either the heart, the kidneys, the brain, the spine, care managers, social workers, and then your therapy teams, which could be physical therapists, occupational therapists, or speech therapists. So when will the hospitalist team visit me each day? That's a great question to ask. Some hospital programs know that your doctor will be around every morning. Some will know that they're going to come around noon. It's a good question to ask the nursing staff. I will tell you, coming from a hospitalist role, that most hospitals will see their sickest patients first, and then they will see their patients that are close to discharge later in the day. But rest assured that your nurse is going to pass any time-sensitive information to the hospitals throughout the day. Will I see my personal physician while I'm at the hospital? The answer is most likely not. Most community physicians prefer to have hospitalists direct your care while you're in the hospital. However, some personal physicians may visit on a social basis. Hospitals will have you follow up with your personal physician shortly after discharge. And that's so pertinent information can be passed along. So maybe a summary of your hospitalized stay, some lab tests, and maybe medication changes that occurred. Friends, now you know what a hospitalist is. Go ahead and like and follow this channel to become an expert in all things hospital.